Today, I will talk to you about osteoarthritis. I will tell you a patient who came to me with osteoarthritis. She is a middle-aged woman. She is slightly obese and she has a sedentary lifestyle. She came to me with pains in both the knee joints. Now, on evaluation, she was found to be having osteoarthritis. What is osteoarthritis? Osteoarthritis is a degenerative disease of the joints. Now, why does osteoarthritis occur? Osteoarthritis occurs mostly because of age factor. As the age advances, the joints degenerate and people do develop osteoarthritis. Now, what causes osteoarthritis? Number one, age. Number two, joint injury. If there is any joint injury in the past, for example, if the person has met any accident or if there is any twist or turn or sprain of the joint, then also basing on the extent of the damage of the joint, the patient can develop osteoarthritis or early osteoarthritis in that joint. And if the patient is obese, their knees will get degraded very easily, degenerated very easily, and so they can develop osteoarthritis. If the patient is having sedentary lifestyle, the patient can develop osteoarthritis. Or if the patient has a genetic history of parents having osteoarthritis, sometimes people can acquire it from their parents because of the genes. Now, this patient came to me with a lot of pain in the joints. This is one of the major symptoms of osteoarthritis. What are the symptoms of osteoarthritis? Pain may be there, stiffness may be there, or tenderness in the joint may be there, or sometimes there may be a grating sensation inside the joint, or sometimes there may be swelling of the joint, or sometimes there may be bone spurs developing in the joints. These are the common symptoms of osteoarthritis. Now, if at all a patient neglects osteoarthritis, what happens? It can cause some complications. It can cause some complications like chondrolysis, which means that the joint tissue, the cartilage tissue in the joint will lyse or break and get degenerated. Or it can cause sometimes osteonecrosis, where the bone itself will get damaged. Or it can cause sometimes small easy fractures in the bones, or it can cause bleeding inside the bones, or it can cause infection inside the bony joints, or it can cause deterioration of the tendons and the ligaments which are present in that joint. Sometimes the nerves passing through the joint also can get pinched and damaged. These are the common complications of osteoarthritis. Now, this patient who came to me, she had pain in the joint, she had mild stiffness of the joint, but no swelling at all. Now, this patient, she wanted a complete relief from osteoarthritis. She said, "Doctor, I'm taking some medication, but it's not helping me much. I want complete relief from osteoarthritis." Now, she opted for integrative medicine approach. What is integrative medicine approach? Using allopathy and homeopathy together is called integrative medicine approach. When I saw her case, she was on painkillers, and for osteoarthritis in allopathy, we generally give painkillers in the oral form, in the tablet form. And we also have some medicines which will preserve the joint and the cartilage. Those medicines like glucosamine, diacerin, we use those medicines. These can help the patient to have symptomatic relief, and these medicines can prevent the damage of the cartilage. And sometimes we give injections of steroids into the joint, which will retard the progression of osteoarthritis and heal the osteoarthritis to a certain extent. Now, if the patient is having mild disease, instead of giving painkillers orally, we advocate creams to the patient, because in research it was found out that creams, when they are used on the skin, they don't have any side effects, and also they are known to give good amount of release on par with the oral medication. So creams also can be used for the patients. Not only that, the patient can undergo lifestyle modifications. For example, if the patient is sedentary, the patient should not be sedentary. People who are sedentary will develop osteoarthritis little early. So if at all the patient is having a sedentary lifestyle, they have to change their sedentary lifestyle. They need to be a little more active. And if the patient has got obesity, if the patient is obese or overweight, it is good for the patient to reduce the overweight and come into the normal BMI, and if the person comes to normal BMI, they can become symptomatically better. And if the patient is advancing into the disease, or if the patient has advanced much into the disease, the patient may require using some canes or walkers to walk. And if the patient joint is damaged too much, then the patient needs to go for surgical therapy like total knee replacement, joint replacement therapy. This is how we treat the patient with allopathy. And this patient told me that I'm already using some medicines, but I'm not having much relief, and I developed this for the past few months, so I want it to be completely cured and treated and gone. So she opted for integrative medicine approach. Integrative medicine approach means, as I told you already, using allopathy and homeopathy together. And she used homeopathy along with her allopathic medication. And in homeopathy also we have good medicines with which we can treat the patient. There are good medicines which can heal the joint and regenerate the joint. So people who opt for integrative medicine approach will get the best from both the systems like allopathy and homeopathy. And this patient opted for integrative medicine approach, and over a period of few months she became much better. This is the good news of integrative medicine approach for those people who want to take it, because they get the advantage of both the allopathy and homeopathy. And homeopathy also will prevent the degeneration of the joint, and it will preserve the health of the joint, and the patient can get the advantage and get cured sometimes completely from the disease. Thank you.